I'm Christian Nix, also known as the Barefoot Doctor. This is Barefoot Medicine Training, Better Living Through Ancient Healing Secrets. In this short video, I want to talk to you about one of the very common complications that a lot of people are going to deal with. If you develop a chronic digestive illness, even if this is not your primary problem, a lot of people will develop hiatal hernia. Now, as usual, I'm going to tell you why modern medicine really doesn't have any solutions for something like hiatal hernia. Just so you know, those of you who may not be familiar with what it is, upward pressure pushes the top of the stomach through the diaphragm muscle. The diaphragm muscle is a transverse muscle that basically sits below the lungs and the heart, right? And above your digestive organs, your stomach, your intestines, etc. And upward pressure will push the top of the stomach where it connects to the esophagus upward through that muscle. And the esophagus connects down through a hole in the diaphragm muscle. And when the stomach pushes up through this, you get what's called a hiatal hernia. That's the herniation. The hernia is the stomach is pushing upward. Now, if you have this diagnosis, or if you have this as a complication, as one of the components of your digestive illness, I'm going to explain to you why this happens so frequently. But if you do get this and you're talking with a mainstream medical doctor, the first, last, and only thing that they will tell you is that you're going to need surgery to repair this. Now, obviously, major abdominal surgery of any kind for any reason is a big deal. It's not something that you want to do lightly. If you do need surgery, it needs to be the absolute last possible resort, because once you cut the body open, and just the act of surgery itself, going under general anesthesia and the possibility that you're going to end up with a hospital infection, which could kill you very quickly, all of the possible risks, dangers, complications that come from a major surgery where they have to cut your abdomen open is serious business, right? This is not something that you should run to choose to have done. And yet for most people, obviously when your doctor gives you a kind of order like that and says, look, you have a hiatal hernia, the only thing we can do to fix it is to cut you open and perform surgery to fix this. Now, it is true that very often if you need surgery, and very few people actually need surgery for hiatal hernia for reasons that I'm about to explain, it can be very successful. There's no doubt, right? For some people, it does help. And I am not saying that there's no place for surgery. What I am saying is this is not something that you should rush to do. It is by no means the first line of healing that you should attempt. It's the last thing that you should do when nothing else has worked. So why do people rush to get surgery on this? Well, first of all, because your doctor told you. Second of all, because as I explain in all my videos, the mainstream medical system is stuck in a philosophical model about health and illness, about the way the body works. And this can variously be described as a reductionistic model. But this approach to medicine basically breaks the body down to a machine. Treating the body like a machine is very effective. It's especially effective in emergency conditions. Obviously, if your limbs get ripped off, or if your heart stops, or if you get punctured and blood is coming out of you, the modern emergency medical system is the way to go. It's an absolute miracle. Things that they can do today that are completely and totally routine would be seen as magic, right? If you brought somebody back from the dead from hundreds of years ago and you showed them a modern emergency medical system or the modern emergency room, you would conclude, if you were brought back from the dead several hundred years ago, that that is magic. So it's an impressive achievement that modern medicine can actually handle emergencies on that level. However, what's the problem with that? What's the problem with that way of thinking about the body as a machine? Well, the first problem is nobody needs emergency medicine every single day. It's great to know that we have it. It's a fantastic system when it's called for. Obviously, we're all very pleased that we can call on an emergency room in an actual emergency, but the modern emergency medical system that treats the body like a machine is almost useless. And in fact, I make the case that the emergency medical system is worse than useless. It's actually dangerous. It's counterproductive. The so-called solutions that they offer you for chronic conditions, like a hiatal hernia, are actually worse than useless because they complicate your healing process. Hiatal hernia will go away in almost every case if you remove the cause of the upward pressure. Why is the stomach pushing upward through the diaphragm muscle? It's not levitating, it's not defying gravity. There's something underneath it that's pushing upward. And this is something that I get into in my material, a protocol that I refer to as the pivot protocol. And I explain elsewhere where this protocol got its name. It actually comes from ancient medical thinking. This is not my word for it. I actually translated it from an ancient text. They talk about the pivot, and the pivot is the system inside you that helps your body heal on its own. It is closely tied to your digestive organs, which makes sense because your digestive system really is the basis for all health in every other system of your body. That's why we eat food multiple times a day, to keep the body going so that you have fuel and resources to fuel the various things that are required to not only keep you alive, but to keep you healthy. Your body does know how to heal things on its own. So what is causing this upward pressure? Well, I spend a lot of time in my pivot protocol material talking about the mechanisms, the disease mechanisms of the various chronic conditions in all chronic digestive illness. And one of the primary mechanisms that shows up again and again and again in digestive disorders is food stagnation. Food stagnation is exactly what it sounds like, and this highlights the very, very useful quality of the ancient medical system that I try to share with people on this channel, which is you can understand your condition in a way that makes sense to you so that you can take simple steps that also make sense to you to remove these disease mechanisms. If you want a hiatal hernia to slip back down, if you want the stomach to descend and for the hernia to heal on its own, you have to remove the cause, the root cause that's pushing the stomach upward through the diaphragm muscle. And one of the primary mechanisms that's causing that is food stagnation. Food is stagnating, food and waste are building up inside the intestines, and the intestines are filling up and pushing the stomach upward, causing this herniation through the diaphragm muscle. This is a very easy thing to deal with. I've taught tens of thousands of people how to fix their digestive condition in a way that makes sense to you so that the actions that you take, the foods that you choose, the food combinations that you're using in your healing journey are actually removing the root cause of something like food stagnation. So if you want to know how to resolve food stagnation and how to design your meals and your food combinations for your specific symptoms, I've created a special one-page document with 5 tips that can help you feel better by tomorrow. The link is below this video. Then check out my free 1-hour video training where I share with you how you can learn to master your body's self-healing system, your pivot, to recover from just about any chronic digestive condition, including hiatal hernia, without pills, expensive supplements, or pointless doctor visits. That's it from me. If you enjoy this channel, please hit the subscribe button so you're alerted every time I drop a new educational video like this one. Thanks for listening, and thanks for your support of my work. And remember, your body knows how to heal on its own.